All right. Well, first of all, I want to say thank you very much for everybody joining us. This is our second year doing this. This is our Institute for Healthcare Advancement National Action Plan to Improve Health Literacy live interactive national social media event. This is going live out over the internet for everybody who is joining us online. Thank you very much. Welcome. We appreciate your being here. For everybody who has made it and is in the room, welcome very much. Welcome to our conference. We appreciate your guys being here. I want to introduce Cynthia Bauer, who is from the CDC. She is the lead author on the document, the National Action Plan to Improve Health Literacy. And in just a moment, I'm going to turn it over to her, and she's going to give you a little bit of information, a little bit of background about the document, how that came about, what its purpose is, and its application and sort of its relevance, those sorts of things. I did want to talk a little bit first about what we want to accomplish here today. This is an opportunity for us to share some of the things that we're doing. The reason that you're here is because you understand that health literacy is an issue. It is a concern. It is a factor that affects virtually everybody who interacts with the healthcare system. Our job is to help people to understand the healthcare system, use the healthcare system in a more appropriate fashion so that we can accomplish a number of things, allow people to take care of themselves, allow them to understand what their healthcare is about, allow them to make more informed decisions, and the list goes on and on. And the speakers that we have for this conference today, tomorrow, and Friday are going to talk about a lot of different aspects for that. For today, we want to talk about the National Action Plan. What is this action plan? What is the purpose? How do I use this? How is this going to benefit me? How is this going to help my organization? How do I write an action plan? And for those of you who are here in the audience, I encourage you to stay on for the second half of this session, which is the workshop on how to write your own action plan. We're going to walk through some of the ways, the mindsets for getting yourself ready to do that. We have a document that we're going to pass out when we're ready to do that, so you can actually start thinking about it and maybe start writing down a few things. You're not going to get an action plan totally written today, but what you are going to do is feel a lot more confident and comfortable in working on this when you go back and work with the other people in your organization. So we're going to kind of walk through that. The purpose of our sharing stories is so we can see what other people are doing. Stories are very important. Stories are very powerful. It's the way we have a shared experience among one another. So when we say we had a success, we can share in that success. If we've had challenges, we can listen to those challenges, see how those challenges are similar to ones that we have, and see how those challenges might be overcome. So that's some of the things that we want to accomplish today. Again, I want to welcome you all here. Thank you for being here. And now I want to turn it over to Cynthia Bauer to set the stage and talk a little bit about the National Action Plan. Cynthia.
Great. Thank you very much, Michael. And it's very exciting to see all of you here, to know about the people who are tuning in online. When you work on a document like I did with my colleagues, and this was really a collective achievement. There were many, many other staff within the Department of Health and Human Services who made this document happen. Those of you who participated in the town halls that we held leading up to it, all of you were contributors and made that National Action Plan happen. But when you do that kind of document, you worry, is anybody ever going to use this again? We talked in a session right before this about how documents sit on the shelf and become dusty. They might have a nice cover, they might have some nice graphics, but then does anybody ever open them up again and use them? So the fact that you're all here today, the fact that we've had stories coming in on the listserv, the links listserv all week about people using the National Action Plan, that means that the National Action Plan is a living document. It's not just sitting on a shelf somewhere getting dusty. It's real. People are using it. And they're using it to think proactively and strategically about how to make change. And that's really what we're here to talk about for the next hour, is the kind of change that's already happening and the kind of change people would like to see happen. And we went through a visioning process when we were working on the National Action Plan. We asked people to think about that future. because it can frankly be a little grim if you think about where we are today. It's as Rima Rudd and others, Joanne Schwartzberg from the American Medical Association have said on numerous occasions, it's hard to be a healthcare consumer in our country. It's not an easy thing to do. And so the actions that the National Action Plan lays out are intended to create a different reality for how people interact, not just with the healthcare system, but also with the public health system, which is the side of the house I come from. Michael wanted me just to say a little bit about what the action plan is supposed to do. Health literacy, as we know, is made up of people working in many different areas, many different disciplines and types of practice, public health, medicine, dentistry, pharmacy, health education, social work. We come from all areas. And the National Action Plan then is that framework to integrate all those different points of view, those different sets of experiences, and give us a common way of looking at this problem of how do people get accurate, accessible, and actionable health information and services from us. We spend a lot of money in this country trying to do that, and we believe that health literacy could make a big difference in how we go about doing that. Michael also wanted me just to make one observation. The National Action Plan, your own action plan, a project that you're doing, none of those should ever be about a specific individual. And that's, I think, what a lot of us still continue to struggle with. We're still at the beginning of that curve where maybe a lot of these things seem to be about a person. They're very, kind of like, well, if so-and-so's doing it, well, that's their thing. They're kind of taking care of it and handling it. Health literacy really has to be the entire organization's business. It should not depend on whether you or I show up at the meeting at 10 o'clock on Thursday and talk about health literacy. It really has to be one of those things that's institutionalized and practiced in an everyday way by all of the people in that organization who are delivering health information and services. So, if your stories could kind of speak to that, are you at that stage where you're still the only person speaking up about this? Is it still really about you? And how do you see getting to that next level, that next phase in which more of your colleagues are really engaged in that process? I think that's really would be useful information for everyone.
And that really is a very, very critical phase and a critical step. If you get the sense that it's the old phrase about if I were run over by a bus. If I were run over by a bus or if I left the company, would health literacy leave with me? That can't be the situation. That's a question that you must ask yourself. And if the answer to that is yes, then that's something that needs to be on your to-do list. And we will be talking about that in the session after this, and that point is actually in the workbook as well. So if anybody online is having a viewing party and they're going to work on their National Action Plan after this talk, I want to make sure that that's something that you address. This must be integrated into the culture of your organization. This must be part of your processes. It has to be something that is a regular step that happens whether you're there or not. So that's a very good point, and I think that's also a very, very important one, and we are going to talk about that in the next session.
So I think, we're very excited to get to the storytelling and hear what's going on, so I'll turn it back to Michael.
Thank you. Okay. Well, thank you, Cynthia, for sharing some of the insight on there. This was a real labor of love. She was talking about this a little earlier. It was sort of a 5-year gestation period for this document from when they first started until it actually happened, and now it's been out there for 2 years. So what we want to talk about is some of the ways in which people have done that. I'd like to start off first with somebody in the audience. If there's somebody in the audience who'd like to make your way over to the microphone and share one of your experiences about something that you've implemented as an action plan in your organization, and talk about something that you've done, and maybe we can talk a little bit about that process. Then we will make sure we don't deafen everybody. And we'd like to go ahead and hear that story. So there were a few people who raised their hand ahead of time. If I could ask one of those folks to make your way over to the microphone and be the first one to break the ice. Thank you very much. Could you introduce yourself? Who are you? Where are you from?
Good morning. I'm Deborah O'Neill. I'm from the Kansas Head Start Association in Lawrence, Kansas. And I actually had talked to Cynthia not too long ago, so I hope what I am going to tell you is kind of on target with what you're hoping for. About 6 to 8 years ago, we brought the book What to Do When Your Child Gets Sick to Kansas and implemented it in our Kansas Head Start Association in some of our different programs around the state. It was very successful, and as a result of that, we have broadened that and are introducing health literacy, I hope, throughout the state of Kansas. We have a project now that's grant funded where we're taking the curriculum that we have developed for what to do when your child gets sick. We're taking it into hospitals, we're taking it into safety net clinics, the public health centers around the state, the WIC clinics, and we're educating parents about, well, we're educating practitioners who then, with their populations, are educating parents about what to do when their child gets sick. As a result of this, I think we're bringing health literacy and the topic of health literacy to many professionals and practitioners around the state, because when we're in some of our training programs, I'll say, I hope you all understand health literacy, and sometimes I get a blank stare, and I know these are some of our medical practitioners. So it's nice to know that we're raising their awareness, talking about plain language in many of the different areas, communication skills, all of the different things that go along with promoting health literacy. But as a result of this, what we have found is in the pre and post evaluations we've been able to do with some of our pilot projects, we have seen a 55% decrease in the number of children who are going to emergency rooms. We're seeing a 46% decrease in that population going to unnecessary doctor's visits. And we're seeing over 50% a decrease in the number of absences of parents from work and children from school. So we know that this is really making a difference. And Kansas is somewhat of an agrarian state. We do have some areas that are, of course, that are more populated, but we do have a shortage of doctors around the state. So we find that this is also very helpful in helping parents be able to know what they can do at home and empowering them to be better parents when they're dealing with children's illnesses. So, thank you.
Yeah, that's great. Can you stay up there for a second? Because
Yes.
I just want to ask a couple questions. So this is a great program, and there's a number of programs around the country that are kind of similar to that. Could you tell us what was your process? How did that sort of start out? In other words, at some point you had to say, or maybe you did say, there's this need there, and we need to meet that need, and how can we meet that? Can you talk just a second about how the whole project kind of started at the beginning and how you identified that and moved it forward?
Well, our executive director was here in California at a meeting several years ago for Head Start and heard about the book and brought it back and wrote a grant to be able to bring it to Kansas. And once we got it there and began to see how effective it was, her desire was to get it out into other areas. And the model that was set up for Head Starts was not quite as applicable to some other areas. So she actually hired 2 individuals from the University of Kansas to redo or to do a curriculum that would be a little more user-friendly for some of the different facilities that we're wanting to come into. I have been on for about a year trying to get the word out, and we have, at this point, in addition to our Head Starts, we had 16 programs that were up and running until 2 weeks ago, and we had 2 trainings in Wichita, and we now have 40 programs up and running. And as Mary said to me, I think it's gone viral. My phone's been ringing even this morning out here, my cell phone, people wanting to get in. So we have hospitals, and we have particularly the health departments around the state that are calling us and wanting the training so that they can use the books and provide the training and the books to their families. So that's been our process so far.
Right.
Yeah, and the thing that I really like, I mean, Deborah and I have seen each other like every 2 weeks for the last 6 weeks, actually, because we started at the Health Literacy Iowa meeting, and then we were in Kansas, and now we're here. So the thing that I love about their story is that it's, as Michael said, it started with a real need, right? They had a problem to solve, right? And so health literacy was part of that solution. But also, it's looking at those programs that are going to be delivered anyway. Right, Head Start's going to exist whether or not we address the health literacy issues. The question is, could focusing on the health literacy issues make it a better program, make it more effective, make it better for the participants, make it better for the state and the federal government that is funding that program? And I think that's a really important point to remember, is that a lot of people start wringing their hands or say, oh, I had some project money, but it went away, my director changed, whatever. There are real programs funding health literacy related work now. Find those programs and tap into them with your health literacy knowledge and expertise and help make those better programs. And just to kind of link back to the 7 goal areas, your program's a really great illustration of what we meant under Goal 4, about where you connect with these other community-based activities that aren't necessarily public health or healthcare driven, but they're still part of that health literacy infrastructure that we need. So it's a great example.
And another thing that I really want to highlight here, because it's a very good point. We were actually just talking about this just before we started. Is that you have some very concrete measurements in there. You said there was some pre and post questions that you did. The importance of that cannot be overstated. When we, in order for us, I was trying to remember how the quote was. If it doesn't get measured, it doesn't get done. And the ability to really capture that information and say, here is a difference that we made, is something that you do at the very beginning. It's part of that planning process. You can't just kind of add that on at the end. So one of the things we were talking a little earlier about, for instance, a pilot program. All right, so you have a pilot program, you go out, you hand out materials written at a 5th grade level to people, you know, in your clinic or at a WIC office or wherever, and it's like, okay, that was great. Well, was it successful? Gee, I don't know. That's something that you want to make sure you build in at the very beginning of your process so that you can capture that information and you can see, did this program work? So you can structure that, talk to people who are, you know, good at designing methodology for projects like that. As a matter of fact, Sabrina Kurtz-Rossi is doing a great breakout session at this conference on program evaluation, and she'll talk about all those components that you have to have in place to see whether your program is actually a you know, a good program. So I'm imagining that was part of your process at the very beginning to be able to capture that data. And then what are you going to? So I guess the other question would be, what is your next step for this? What are you?
Our next step is to find money to sustain this once the grant money runs out, which is the end of 2012. So we're pursuing several different factors. We are looking outside the state. I know there are different places that are interested in perhaps bringing this program to their states. We're also looking internally from some of the Medicaid programs because we also know that this is going to save money on Medicaid. We're looking to some of the insurance funders who are coming into the state. So we're looking at several different avenues to be able to sustain the program. We're also looking at coming up with a web-based format so that it will be easier then to provide this to other venues and other people in other locations.
Excellent.
Thank you.
Thank you, Debbie. Appreciate your sharing that. Okay, maybe we could have one more person from the audience before we look to some of the other ones. Stephen.
Sure.
Thank you.
Hi, I'm Steve Rush, and I'm the director of the United Health Group Health Literacy Innovations Program. And last year we had 3 health literacy presentations at this conference, so we're pretty excited about that. We've used the National Action Plan to improve health literacy as part of our enterprise-wide health literacy audit, if you will. So we took some of the strategies and tactics that were listed out in the action plan. We wove it into our vision and mission, and we were able to track what we were doing okay on and what we needed to do better on. We have the Health Literacy Innovation Program focuses on a number of areas, and one of them is training. So we have awareness training because people need to know what some of the challenges are that are associated with health communications. And then we also have skills training. So we're training people in how to use our tools and resources that we've developed. We have a blue book. It's a styles and standards manual for creating written communication using plain language and appropriate design principles. And we've woven in some of the helping diverse populations understand issues. We've created a glossary of terms both in English and in Spanish because we know that complex terms are really difficult for people to understand and use. And it's a web-based tool, and we've been growing that. And we tied the glossary in to a tool that we've created called DocScrub. And that's used to determine readability level. And one of the biggest challenges that we have is to let people know that health literacy means more than just a reading grade level. But it does mean, how do we look at things like math skills and cognitive processing skills, and beginning to really move into a consumer-centric design mode instead of an organizational design mode. So in 2.5 years that the program has been in existence, we've trained over 12,000 internal people on health literacy awareness. We've trained over 1,500 people in health literacy skills. And we've trained over 1,000 external people, including some of our vendors. So we've done training, we've done tools and resources, we're creating evaluation tools so that we can measure the suitability of the materials that we create, not only in written communications, but web-based communications and spoken communications. And we've done some research, and we're partnering with a number of health literacy institutions. And internally, we did some research, and some of which you can do also, and that is we took a look at a CAPS-like question, and that was, to what extent are you able to understand written communications from your health insurance plan? And we found that those people who had the greatest difficulty tended to make 2 to 3 times more calls to a call center. And equating that out, it was, if we could communicate more effectively the first time around, we could probably save $4.3 million. And that's just the tip of the iceberg, just in call avoidance. But we know that people with low health literacy oftentimes don't feel empowered enough to make those telephone calls. That's why we say it's the tip of the iceberg. We've also done some other research, and we found that people with low health literacy oftentimes will access the healthcare system later in the life history of their disease, and therefore it costs more money in terms of services, in terms of the cost of service and the number of services. And most importantly, it creates more problems for the individual and their family beyond the cost of health care. And ultimately, we feel that understanding language of health is a key to living a healthier life.
Thank you, Stephen. And if you could stay there for just a second. You're in a very unique position, being at a major corporation, at United Healthcare. This is a major health plan. And the challenges, I would think, in terms of starting such an initiative are quite daunting. And I think there's probably some people, I think, in a way, starting it at a small organization, there's an awful lot of challenges there, but also at an enormous corporate type of environment like that poses its own set of challenges. Could you talk just a little bit about the seeds, the beginning, the genesis of that whole process of health literacy at United? How did that start? Did you get advocates? Did you get buy-in from senior management? How was that achieved? Maybe just talk a little bit about that, just to see, because obviously it sounds like this has been a very successful program. And somebody who's at a large company like that and wants to start, it would be nice to know, some of the things that you use to get that ball rolling and get to where you are.
So 2.5 years ago, there was a need within the organization to communicate more effectively with our members and our consumers. And there were some visionary people who kind of worked as advisors and brought me on. And to a point that you raised previously, at the very beginning, I felt like I was a one-man band. I had cymbals at my knees and a harmonica and an accordion. But now we have an executive corporate sponsor, and that's Chief of Medical Affairs. We have an executive clinical sponsor, a physician. We have an advisors group, and they tended to be the chief marketing officers of multiple business segments within United, and now we're starting to get the clinical people. And then there was me as the director, and then within each of the business segments, we had representatives. So sitting with me today, we have a chief dental officer, we have an operations person, we have a pharmacy person, and we have other people who are listening in. And so that should something happen to me today, there are enough people around with the energy and the passion and the insight and the infrastructure to be able to move it forward. And we do have really good support from leadership on this.
So you did have, there was some awareness there. This wasn't a battle that you had to kind of twist some arms and get people to say, present a business case for this, and to say this was something that really needed to be integrated into the company. That was, you're saying that these people were kind of already on board and had bought into that.
A portion of the people within the organization were on board.
Right.
But yes, it is. It's still a struggle, as within any organization, to look at itself and to say, hey, listen, we probably could be doing things better. And there was, when we talked about health literacy, the people would say, what is health literacy? And I would say what it was. And they said, well, sure, it's mom, apple pie, the American flag, but what's the business case for it? And
right.
Part of that was why we started doing some of the research, like costs and cost avoidance. But we also have a social responsibility to be able to go out into the community and help people live healthier lives and to navigate the healthcare system. But it's still a challenge, and you still get bumps on the head from people, bumping into the wall.
Yep.
And people saying, well, show me. But some of the things that have occurred, like the Plain Writing Act and the rules from HHS and the rules from CMS that came out, and the consumers, the employers, the other folks who are saying, help my people, help my employees understand how to use the healthcare system better. Right. So that there's internal and external pressures, and even if we don't have the best business case because we're still doing the research, we still have enough people coming at it from the governmental level and the regulatory level and accreditation and quality levels to say, hey, listen, you got to do this.
Right.
Yeah, I just want to kind of emphasize something you said there, Steve, is that, your effort has really aligned with those internal values and incentives of your organization. And I think sometimes we kind of come in all fired up and it's like everybody needs to care about health literacy for the same reasons we do. They don't. They don't have to care for the same reasons, but they just have to care. It just has to figure out, we have to figure out how to align it with what they're interested in. So in your case, it has to be bottom line, social responsibility, and regulatory compliance because of the business space that you're in. In the space that I'm in, government agency, we're currently having to align with the Plain Writing Act. That's a federal law. It applies to our agency. We now have to demonstrate that's compliance for us, is following this federal law. So I think it's really being clear about what are those sort of internal values and incentives and triggers and making sure that health literacy lines up. And I think you guys have done a great job of demonstrating that.
And that's, yeah, exactly. I think one of the key points here is that even if people, if they're kind of fence-sitting on the validity or the value of health literacy, when you can tie that to your mission, when you can tie that to things like safety, when you can tie those things to values that your company holds, as, especially dear, those are other strategies that you can use to help you to move these things along. You're going to have people who are just saying, that's kind of a nice thing to do, not a need to do. It's not a real important one. That's when you have to kind of bring out some of these other kinds of issues. For those of you who are here, one of the breakout sessions that we have is a team from Merck is going to share some examples of how they integrated health literacy into the into the fabric and into the whole process at a pharma company. And so there's some lessons that could be learned there. Steve, how can people learn some lessons from things that you have done there in terms of health literacy? Are there some resources they can tap into? What would be the best way to help them share some of the successes and learn how you guys did this?
Well, we participate in the AHIP Health Literacy Task Force.
Explain what AHIP is. You just used an acronym.
America's
Steve.
Health Insurance Plan.
Okay.
That's health literacy. Yes, it is.
Right.
America's Health Insurance Plan, AHIP Health Literacy Task Force. AHIP has done some really nice work in pulling together information that a number of insurance companies are doing. If people are interested, they can contact me. I'm in the directory over here, and we do have some other things going on. Do I have a budget? We're working on getting a dedicated budget, but it's persuasion and influence of the business owners to come up with dollars. So the fact that we've been able to move along the way we have is evidence of the fact that people see value in what we're doing.
And that's very important when we're talking about doing this, that if you're able, to the extent you're able to piggyback your efforts on things that are already being done, so that you're improving existing processes, so that when you say we're implementing some health literacy strategies and examples here, that it's not going to be its own cost center, that you're at least sitting at the table when those meetings are taking place, that when patient education materials are being sent out, when letters to members are being sent out, that they make a stop at the health literacy desk, that that person is reviewing them for readability, usability, those kinds of things. Those are some other strategies, so that when the issue of somebody looks at you and says, okay, health literacy is great, what's it going to cost me? Then you can say, you know, if we just implement it as part of our normal process and the things we're already doing, there's really not a whole additional cost there. That's one strategy you can use to kind of implement that. Great. Thank you, Steve. I appreciate your sharing. Do we have a, is there some, there was somebody who had sent in a tweet. Are we ready for that, or do we want to go to one of our other online stories? Okay. Okay, can we switch over to our slides for some of the stories that people had submitted? Okay. During the week, and I want to send out my thanks to Julie McKinney, who is the moderator. Julie, stand up, say hello. Thank you, Julie. Julie is the moderator of the Links Health Literacy Listserv. If you are not signed on to that, I strongly, strongly encourage you to do that. This is a community of about 1,500, 1,600 people around the country.
Around the world.
Around the world, I'm sorry, pardon me, around the world, who are part of this listserv. And this is an area, it's a forum for you to ask questions, weigh in on what people are doing, offer resources, contribute to kind of a world conversation about health literacy. So during last week, Julie was gracious enough to allow us to have a moderated discussion about this event today. And we asked people to submit their stories to us to sort of share some of those things during that week on this discussion. And if you're not signed up for that, we have information about that. Julie is actually doing a breakout session about finding health literacy resources, and I'm sure she'll talk about that. But if not, certainly look for Julie during the conference, and she can give you directions on how to sign up for that. So if you look up at your screen here, for those who are in the room, we have a story. We have actually, let's go to our first one. Here we go. This one is from Dr. Sandra Smith at the Center for Health Literacy Promotion. Sandra, are you actually in the room? No? Okay. So Sandra submitted her story, and this was about integrating health literacy promotion into the medical home model in Medicaid managed care. So this is just another environment, a way in which we are, one segment of the healthcare system that she's working in, and ways in which she can kind of integrate health literacy into this portion of it, which is the medical home model, which is basically we have one place where you come for your primary care, so that we keep track of your records, we keep track of your medications, we know who you are. Whenever you need treatment, we help you to monitor and manage your chronic illness, and you're going to one place so that that's not fragmented care, it's more integrated, complete care. And so what they were looking to do was to find ways in which they could really use some health literacy principles to strengthen that communication, allow people to use the system a little more efficiently. So some of the things that they are doing there at the Center for Health Literacy Promotion in Seattle, they're training outreach workers in home setting, personalizing information and applying it to real-life context. So this is one way in which in that one-on-one discussion and process, so that when people go out to the home, it's not just putting out general information. They're able to make that information specifically appropriate and understandable and usable for that one person. So it's really bringing it down to that one-on-one level and making sure that people are understanding that. And we're going to have some other sessions during our conference that really talk about that, talking about using processes such as teach-back, where you really make sure that people understand. Rebecca Sidori, Dr. Sidori is going to be talking tomorrow about that. They're focusing on developing interactive and reflective skills. This is funded by the insurer, and they are receiving incentives from the Affordable Care Act, along with HEDIS standards, which are requiring insurers to get serious about prevention. So there are dollars out there. There are ways to help fund these kinds of efforts. It's really just kind of working within, finding out where those funding things are and you know, how to access them.
Yeah, I just want to pick up on that last bullet point there, is that you know, every part of the healthcare system is really being affected by what's happening with changes under not just the Affordable Care Act, but what's happening with the rollout of electronic health records across this country. And so those are changes, again, that are going to happen no matter what. And the issue is sort of how do you tap into those changes to align them with what you're trying to achieve from a health literacy perspective. There are a lot of opportunities around prevention that were introduced by the Affordable Care Act, and so that's another way to engage people in that broader sense. It's not just, again, about doctor-patient communication, but it's about how people live their lives, their health concerns, apart from their average of 2 visits a year they might make to an actual healthcare provider. So I think that last point that Sandra made is really important as you kind of think about your sort of future goals and objectives in this area.
Right. Okay. I just want to let everybody know we have about 50 people who are signed on and watching us online, and those are just the ones who are actually logging into our website and watching. And there's, if you look up at the screen over here, you're seeing the tweets that are coming up, and so you can kind of see that people are participating on Twitter as well. I'd like to, let's share one more story that was submitted to us on the listserv last week. This one is from, and I'm going to mispronounce her last name, Tammy Pilisek. I'm not sure. I read her name quite a bit, but I've never actually met her. She's with the California Department of Public Health. And her story, or her national action plan, has to do with integrating health literacy as an initiative to all public health employees. So again, this is a little more of an internal process. This is more of an awareness raising and a training sort of an issue, a little bit of what Steve Rush from United was talking about. Her efforts are focused on better communication, regardless of whether employees are dealing with patients directly or indirectly. That is really one of the most important aspects especially in a larger company, I mean any size company, but that interaction that you have, whether it's a phone call into the call center, whether it's a letter that you're sending out, if you're in a primary care facility, that one-on-one communication, those conversations that we're having, that's really kind of where, in terms of health literacy, that's where the rubber hits the road, where we are interacting directly with people. Are we being clear? Are we giving them the message, the action that they need to do? Are we testing to make sure that that message has been received and understood, and that they're actually understanding what it is we're trying to communicate? You'll get a lot of this. I understand exactly what you're saying, and right behind the scenes, the little wheels are going around and people are thinking, I have no idea what you're talking about. And there are some processes that you can use, Teachback in particular, to make sure that that communication is going on. They've also organized a panel presentation at the American Public Health Association looking at health literacy from a policy perspective. Remarkably important. Maybe, Cynthia, you could talk a little bit more from the policy perspective in terms of how how important that is. But let me just finish going through here. They've created issue papers that are easy to read and understand, self-assessment tools supporting health literacy, and they've conducted workshops to promote health literacy principles for immunization staff in other countries. This is remarkably important, especially when we're talking about places where people are interacting with the healthcare system really kind of not for the first time, but on a very limited basis. The healthcare system is a remarkably complex thing that is kind of out there, and when people have to access it, a lot of times it's a very frightening kind of situation. And so when we are really training those people who are the ones going out and having those face-to-face things, these are remarkably important aspects, and these are really important things to do so that those messages are actually being understood and received.
Yeah, I want to pick up on Tammy's point about using the American Public Health Association. You know, everybody in this room probably belongs to one or more professional associations of some type. And some of the professional societies are sort of more on board already. You've heard for a long time, if you've been working in health literacy for a while, you obviously know what the American Medical Association has done. The American Dental Association actually has their own strategic plan on health literacy in oral health. We've talked at various points with the American Nursing Association, with the American Academy of Family Practice. No matter what discipline you're in, if you're a health educator, Sophie has for a long time been active in the area of health literacy. No matter what discipline you're in, there's a way to engage your colleagues from a professional development, from a advocacy, from a strategic planning perspective on this. And
you just used an acronym a moment ago, Sophie, so maybe you could
Society
help us
for Public Health Educators,
Thank you.
If you're not a health educator. And I just kind of want to pick up on this public health point. I mean, I engage my public health colleagues all the time on this question of main message. You know, if you're engaged in provider-patient communication, that's typically an oral situation. And as a communicator, I think there are many things going on when you communicate orally with somebody apart from the words that you speak. There's your tone, there's your body language, there's the situation in which you are immediately physically located. There's all those other things that affect how communication works in an oral setting. When we are putting out public health messages, the only thing somebody has to understand our meaning in that moment is that thing that we either wrote or put in the podcast or put in the video or put on our ad or whatever. So we have to be extremely clear. So if we want people to get out of the way of the hurricane, we have to say that. If we want people to get a shot, we have to say that. If we want people to get screened for something, we have to say that. So main message becomes extremely important when you're doing public health communication. So I'm really happy to see my colleagues in public health making health literacy part of their agenda and not just relying on, well, they'll get it from their doctor or their nurse or the next time they're interacting with the healthcare system. There are so many other public health messages we really need to be much clearer about.
Right, and that's a great point. And as a matter of fact, for those of you who are at the conference here, our CEO Gloria Meyer is going to be teaching a session at 2 o'clock today on writing clear messages or writing for a low literate audience, and that's one of her really the main points is just getting that objective, that what do we want you to do right up front. Too often, how many times have we read a letter from somebody and we're reading in 2 or 3 paragraphs and you're saying, okay, okay, down here in the 4th paragraph is something that you're actually asking me to do. That needs to be right up front. We need to talk about that immediately, and Gloria is going to talk about a lot of those kinds of points in her discussion. Also, I want to take a look at a couple of the tweets that are coming in. One of our friends who spoke at our conference a number of years back, Kathy Kastner, tweeted and is talking about, she's not an organization, but she uses social media, blogs, and Twitter to raise awareness about single-syllable words. And this is, using social media and how that message goes out is a really interesting a whole topic that we could have a whole discussion about. And as a matter of fact, we do. We have Michelle Samplin-Salgado is giving a plenary session tomorrow about usability of messages when we are using social media. Social media is all the rage right now. Everybody's tweeting and using Facebook and LinkedIn and blogs and text messages and those sorts of things. But are we understanding those messages? Are we giving those messages to people in a way that they can understand them and in a way that they want to hear them? That's a very important component. We need to keep that in mind, and she's going to talk about that. And there's also a breakout session her and Jenny Anderson are teaching here that's going to be talking about how some of these social media tools work and what's the best way to implement them. So I think it's very important for us when we use these tools to not abandon our health literacy perspective about how we're communicating those messages. They need to be short, simple, to the point, and ones that are of relevance to the recipient, especially when we're talking about a very limited bit of real estate or space or number of words in which we can communicate those kinds of thoughts. We also, have a tweet from Wisconsin Literacy. Is Michelle here? Michelle Erickson?
Over there.
Michelle, could I put you on the spot and ask you to come up and talk a little bit about some of the things that Wisconsin Health Literacy. Michelle Erickson is the executive director of Wisconsin Literacy. They do a wonderful conference there and they have a really great model that if you're looking for something to replicate from a state perspective, she's a great one to start with. So maybe, Michelle, could you share a few of the things that you guys are doing?
Sure, thank you. In a meeting earlier this morning of international attendees, we talked about the National Action Plan and plans in other countries that looked really good but weren't really sexy enough to get attention and into the paper. And we talked about sometimes that requires making that plan come alive and working at the community-based level and seeing individuals who are actually benefiting from health literacy interventions. And we've been working on that in Wisconsin. One of the things that we did this year with a grant from WellPoint and Anthem Blue Cross and Blue Shield was seasonal flu workshops across the state to vulnerable populations where they had an education workshop about seasonal flu and how to prevent it, how to treat it, how to sneeze properly. We gave away insulated lunch bags with hand sanitizers and Kleenex and cough drops and so forth, and we partnered with Walgreens to give the participants a free flu shot, which they could cash in at any Walgreens pharmacy and across the state. And they were able to keep track of those that took advantage of that flu vaccination voucher. And so we were able to measure. We tried to connect our workshops with existing flu clinics. We went to senior centers. We went to homeless shelters. We went to our literacy agencies that we support. We went to the Salvation Army, refugee and migrant agencies, and these flu workshops were very well received. I think there was a tweet about the video that if you are interested in looking at it, it's a 3-minute video that will give you a really good snapshot about how we went about it. And then I just want to take a brief minute to tell you, as a literacy agency, a statewide literacy agency, we've worked hard to get this at the ground level in our communities and among our literacy agencies that we support. Some examples of things in the Northwest, we have some Hmong women at one of our literacy agencies who are in a CNA pre-career pathway training called Step Up to Health Careers, and that leads them, their training, into a community college or technical college CNA training, but they're getting the pre-training at our literacy agency. Another program in the Northwest called Just for the Health of It sends retired nurses and now local dental members from the local dental clinic to a thrift store where they're actually helping seniors, and it's turned into more than seniors, but giving just general health information about medications. They give blood pressure checks and vision checks and so forth. Been very popular. They show up at the thrift store every week and are able to answer questions. In Green Bay, we have a literacy agency that partnered with Bellin College nursing students, and they are working to they're working together. So the Bellin College nursing students are having a real practicum to work with ESL students about what is a normal doctor's visit, how do you fill out a family health form. They did blood pressure checks and so forth. So both literacy agency students as well as the nursing students are benefiting from this intervention. What else? We have Literacy Network in Madison that has kind of a state and actually now a national model around a class called English for Health, and it is really a great class where the hospital, the local hospital sponsors it. They're in their 3rd year of this, and they're bringing a lot of English language learners to the class. They do a mock trial, or I'm sorry, a mock clinic at the end of the 8-week or 12-week class, where the hospital staff participates. They set up a pharmacy, they set up a doctor's appointment, they set up different checks that a patient would see in a clinic. And the students, after this training, will go through and actually practice and simulate real live interactions with a pharmacist, a doctor, a nurse, and so forth. So those are just some of the examples that are going on in Wisconsin around health literacy. It's really goal number 4, but when I looked closer, if you look at goal number 1 and 2 about dissemination and partnerships, I think is goal number 5. I think we're reaching a lot of the goals in the National Action Plan. So sometimes you go about these things and you don't necessarily have one of the goals in mind, but all of a sudden, if you go back and refer to that often, you will find that there are a lot of avenues to take a project and reach some of the different goals.
Thanks, and I just wanted to observe that you guys have been great in organizing your most recent conference around all of the goals and strategies in the National Action Plan.
Yeah, we really have benefited from that, and it's been able to then feature kind of on-the-ground interventions and projects across the country that are working around these 7 goals. In April of 2013, on the 9th and 10th, we'll look at the action plan again, but we'll also look at a recent issued paper, the 10 attributes of a health literate organization, which I know Cynthia's been involved in, and so we're talking about now system change, and the theme is changing systems, changing lives, but how we integrate those goals and the attributes of a health literate organization in order to create more system change.
And I have to say, Michelle, I'm excited that you are the first person, I think, who has used the word sexy and National Action Plan in the same sentence. So we were all here to catch that. I appreciate that. Thank you very much for sharing. And actually, Michelle did reference this document, which is an Institute of Medicine document, the attributes of a health literate organization. I strongly suggest that you download this. In fact, I think for attendees, I think this is actually in your conference material. Cynthia, did you have anything to add about this document?
Yeah, I mean, the attributes really line up with the goals and strategies of the National Action Plan, and many of the same people were involved in both processes. So, you know, not an either-or process. They're really sort of, again, sort of the same piece. You know, the fact that we were able to come up with 10 attributes, you know, can function in a way like a checklist for you, if that's, you know, that's sort of one way to kind of think about it. So I think there's just a lot, this is a really exciting time to be in health literacy. There's just a lot of really good thinking going on about how do you make change at different levels. You just heard Michelle say they're working at the most grassroots level in these flu clinics, these sort of health consultations they're doing in the thrift shop, but then they're also organizing their conferences definitely extends beyond the borders of Wisconsin now. You certainly have attendees from many parts of the U.S. as well as international now. So it's possible to work at all these levels simultaneously. You guys are a great example of how to do that.
Right. I think we have time for one more story. Gloria, did you want to share a story? Or yeah, go ahead and introduce yourself.
Well, this is a little bit negative, so I don't want to be negative, but it's a story of our own clinic. We have a community.
You can introduce yourself.
Pardon?
Just introduce yourself, your name and where you're from.
Oh, Gloria Meyer, and I'm with the Institute for Healthcare Advancement, besides health literacy, we have a community clinic, licensed community clinic, and we see about 45,000 visits a year, so it's a medium size. It's not small, but it's not large. And also, I just want to say that we lose money on every patient we see because we see a tremendous amount of uninsured patients that might pay us $5. So it's not a money maker at all. So, you know, I'm really convinced about low literacy and our health education. So this is all the health education that a lot of times we use from drug companies that is just terrible. So we created 50 pieces of health education material in low literacy. Well, the first thing we had to do is get our 9 doctors, some work part-time, to approve the content. And believe me, that was not easy because they wanted everything in the brochure. And they didn't even like the breast self-exam brochure that won our prize last year from the Susan Komen, because it said you don't need a breast exam every year, and the GYN doctor says, yes, you need one every year. You know, so, but we got it done. So then so when I asked Stephen about the budget, because I'm responsible for the budget, this becomes hard because we're not getting the freebies anymore. Now we're printing them ourselves, and we had it in 4 colors, and we had to do it, so we had to print it ourselves. So we finally got that. And then the drug companies come, and because they know we don't like to put their stuff in, they walk around our lobbies. We have big lobbies because we're busy, and they just put all their drug stuff in all of our containers, and they put our health education material in the back. So then I think I've taught all the MAs, the medical assistants, to go out and clean that up and throw all of that out. And we also orient the MAs. Now, if anybody, and I know there's more community clinics that are coming here than we've had in the past, so if anybody's doing that, the MAs they make $12 to $15 to $16 an hour. So I call that minimum wage. It's certainly not a living wage in California. And they have to do a tremendous amount with insurance, collecting co-pays, you know, getting the right insurance, getting the right name, and you know, and we have a large Hispanic family population, so a lot of times it's the same name. So it's very hard. So we orient them to health literacy. So when they come, they get oriented, but they leave, and new people come. And I haven't been as motivated to teach everybody. We need to teach it probably every 2 months because new people come. So I'm going to write an action plan, and I'm going to say that we really have to teach everybody in the organization, because it can't be Michael and I that do it. They have to be able, the MAs have to be able to do it. Right. And they put signs up, and the signs are terrible. It's in fancy print, and it's very nice. I can't even read the sign. So, so it's just, so it's a little bit of a negative story because it hasn't worked as well, but we do have 50 pieces, and they're on our website, yes, right?
They're on IHAhealthliteracy.org, and you can go there and download those. And that's actually a great, what you mentioned, Gloria, is a great example of making sure that these processes are integrated into your regular processes, because as Gloria said, when there's turnover, you can't just rely on the fact that those people are going to get trained somehow. That has to be part of your normal orientation process, and I think that's what you're talking about in terms of integrating that. So that's a great one. Thank you. I appreciate your sharing that one. Before we end, we're getting very close. I just wanted to say thank you to the people who are out there tweeting, and especially Stacy Brayuka, and I'm probably butchering your name, and my apologies, but she has been prodigiously tweeting during the session here, and she did mention about systemic change is the ultimate goal, but the NAP and the 10 attributes can be strong foundations to build that future, and that's exactly what we're talking about. These are documents that are tools. They are ones that help you to sort of understand what it is that you have, where your problems are, where your needs are at, identify those, identify your organization, what are the pieces in your organization that need to be involved, need to kind of, be part of this entire process, and write it down and capture it. Plan it out ahead of time. put it into motion, measure it afterward, benchmark it, and then kind of go from there. Cynthia, do you have any final comments for us?
Yeah, I just want to pick up on Gloria's point, which I think is actually not negative at all, but extremely positive, is that no matter what your plan looks like, everybody in your organization has to be able to use it. Health literacy has to make sense to everybody, even her $12 or $15 an hour medical assistants. So I think that's a really positive point, is just as we talk about health information, health services have to be outward facing, understandable to everybody, our own actions to change ourselves have to be understandable to everybody in our own organizations, because we need everybody on board with this. It can't just be, you've heard over and over, it can't just be about a few people. So really take that to heart in terms of thinking about whatever plan you write, that plan has to work for everybody in your organization.
Right. Our time is up for this session. I'd like to first of all thank very much Cynthia Bauer from CDC for joining us and giving us her perspective on that. Thank you to the audience and those who shared your stories, to those who submitted your stories online. Sorry we couldn't get to all of those. For those who are out there, the 50-plus people who are watching us, thank you very much. We really appreciate it. If any of you are watching and having a viewing party and you're going to go into your session to write your national action plan, we would love to hear about that. So please tweet us, email us. We'd love to hear how that all went. And thank you to all of those on Twitter who shared your thoughts during this session. We'd love to get your input on your evaluation forms. We do read those. So if you thought this session was of value, ways we could improve this for next year, please let us know that. But for now, I think for the live event, we're going to sign off for that and say thank you very much to everybody who has watched us. And for those in the audience here, we're going to have a session on writing your plan.